yesterday I found an article in Scientific American Mind about caregiving. So I'll just summarize it, and then if you guys have questions or if you have anything else that you want to ask me, we can talk about that as well. If you're not following me, follow me and I'll follow you back. Quick question: why don't you make YouTube videos so you can make money? My videos are all on YouTube. All of the ones that I did in May, they're all on YouTube. But I don't know how to make money. It's really hard to make money off of YouTube. So, and like I mentioned before, I am completely disabled. I receive Social Security disability, and if I make any kind of money, I could lose my Social Security disability. I do have a fundraising page if you want more information about my illness. It's youcaring.com/Marisol has Lyme. It's in my profile. You can go there to get more information or to make a donation. I don't think I'm accepting donations right now, though. I think the donations might be closed, but it has more information about my illness as well. So, pardon my ignorance, but what is Lyme disease? I've heard of it before, but I don't know the details. Lyme disease is a bacterial infection passed through the bite of a tick. So a tick bites you, they pass this bacteria to you, and you have a range of symptoms that go from like arthritis type symptoms, joint pain, fatigue, to severe neurological symptoms like light sensitivity, seizures, I think something called a heart block. You can have a bunch of stuff. You can go into cardiac arrest, severe arthritis, seizures, things like that. So it's a wide range of symptoms. How much do I weigh? I weigh about 90 pounds, and I'm about 5'5" tall. So I'm about 20 pounds underweight, and that is all because of my illness. So some people lose a lot of weight, some people gain weight because of their illness. Hi, Dr. Debs. Hi, mailing it in. So, caregiving in America. Hi, John Norcal. There's an estimated 43.5 million unpaid caregivers in the United States. Maybe about 30 pounds. Some people, yes, are about 30 pounds or more overweight. So there's 43.5 million unpaid caregivers in the United States. So these are people that are not receiving any compensation for their caregiving. Nearly a quarter report that their health has suffered under the strain of caring for another person. So yes, unpaid. These people are not getting paid. And a quarter of them report that their health has suffered. Yes, your hubby is one of them. And yes, my ex-husband was also one of them as well. He was not getting paid for caring for me. So there's a lot of things that happen with caregivers because of, depending on the relationship with the person that they're giving care for, the experience can be better or worse. And that was one of the interesting things about this article. A couple of things that I learned. Scientists have found that culture, gender, and relationship dynamics can explain why some people fare better than others when caring for someone in need. So, greater emotional closeness, for example, if the caregiver is closer emotionally to the person that they're caring for, it is a better experience. If it's a spouse caring for a spouse or a parent caring for a child, healthcare is expensive in America. Yes, healthcare is expensive in America. If the spouse or the parent and the child were already close to begin with, then the experience of caregiving is going to be, yes, better if there's a lot of love and intimacy between the two. If they are not very close, the experience is not as good or rewarding. So that can be very, very difficult if you were not close with that person to begin with. The experience can be a lot more difficult for both people. So caregivers often have a mixed experience. Hi, R. Baker. Caregivers have a mixed experience with caregiving. So there's a combination of positive experiences, feeling like it's rewarding, but also combined with an increasing sense of loss, yearning, and sometimes depression. So a lot of times, even if you're caring for that person appreciates it, there is a sense of loss and depression and sadness accompanying the caregiving. Hi, Ewan. Thank you so much. So it is sort of a mixed bag. You don't really know, depending on the relationship with the person, from my own personal experience, and you guys have heard me talk about this in the past, I am not close with my parents. I do not have a great relationship with my parents. And unfortunately, that has come out, and that has led to a lot of problems between me and my parents with, with my illness and my disability. Do you have I do feel hungry, but unfortunately I cannot eat very much. It can actually be physically painful to eat too much. So, because of, if I can ask why. Well, it's very common, people that have Lyme disease, our disease is not recognized. What about other family members? No, I don't have a lot of family members that I'm very close to. Lyme disease is not a very recognized illness. Some people say that it doesn't even exist. The insurance says that it doesn't exist. Doctors say that it doesn't exist. So when somebody gets diagnosed with an illness that doesn't exist, your parents don't believe it, your friends don't believe it, people think that you're lying. You're talking about being close to my family. My parents have a lot of issues, issues that probably came before they had me and my brother and my sister. Yes, people will say that you just have depression, anxiety, it's a mental issue. But yes, I've never had a good relationship with my parents, but that is because, that's just how they are. So, a lot of that is Lyme disease complicates caregiving. This article was very specific to people with dementia. So a lot of it may not apply to somebody with Lyme disease. You look like you're glowing. Thank you. Struggle with diagnosis too. Lyme isn't consistently diagnosed correctly. Exactly. It is not diagnosed properly. So there's a lot of dynamics that go into, yes, it's not cool at all. There's a lot of dynamics that go into why caregivers and the person being cared for, why things may not go well. Women caregivers. This was one of the most interesting points in this article. Women caregivers have been found time and time again to do a lot worse than male caregivers. You can look beautiful on the outside, yes, and your body is dying on the inside. Exactly. Women do so poorly as caregivers, and wives do the absolute worst. And this is why. Caregiving is seen as a woman's duty. So it's not seen as, wow, you're doing such a wonderful thing. It's seen as, this is your job. This is your obligation. You're a woman and you're supposed to care for this person because you're a woman. And we talked about this. Somebody asked me if it was difficult for me to date. And the reason I said it was difficult is because men are not naturally looked at as caregivers. Women are. So one of my friends who also is chronically ill, he got married a couple years ago, and his wife is great. She's amazing. But, it's easy because it's sexist, yeah. But I think women are just expected to be caregivers, and she has taken care of him a lot. But that is just the expectation. It's easier for a woman to date a man who is sick than for a man to date a woman who is sick, in my opinion. And women suffer because of this, because they're just supposed to be caregivers. So a mom or sis better than a hubby. It's not better for them, but they're just expected to be a caregiver. Husbands, boyfriends, dads, they're not expected to be caregivers. Men receive more appreciation because they're acting against type. I never thought of it before, but you're right, yes. So men receive more appreciation because they're supposed to be, they're not supposed to be caregivers. We'll talk about that, Dabone. We will talk about that. So men are more appreciated. They're also more likely to ask for help. They're also more likely to accept help. Women are more reluctant to use care services because they're supposed to be able to do it on their own. Remember, women are mothers, they're caregivers, they're supposed to be able to do this on their own, so they won't look for help, because then that means that they can't do it. So true, men are called saints if they stay with a sick wife. Yes, they're seen as these amazing people because they're sticking by the side of the sick wife. So men are just more likely to use the resources offered to them because it's not shameful for them to do that. It's shameful for women to ask for help because they are just supposed to know how to take care of somebody. African Americans. So here's where race comes into play. African Americans caring for a loved one with dementia have a more positive experience than whites. Hispanics are second. They also have a positive experience caring for a family member, more than whites, because stronger family connections. And I just think it's cultural. You know, minorities are expected to care for their parents, for, you know, their sick children or sick relatives. I think it's just sort of expected in the culture. So I think they just tend to have more of a positive experience. I don't know if they have a more positive experience or they just have to have a more positive experience because there really is no other option. So that was the one thing that I sort of questioned in this article. Women need to let go of the belief that they are the default caregivers. They should seek support because women are going to end up burning out if they don't ask for help. And they need to stop looking at themselves as being, oh, well, this is my obligation. I can't ask for help. I have to do this. I should just know how to do this. So there were a few things in this article that were really great. So they had a little chart. There was a little chart talking about the top tips. I'm sorry, I missed that comment. I'll take comments at the end. Top tips for caregivers. These are the key elements for managing stress. How do you transition a dating partner into the role of a caregiver? Exactly. You really can't. You can't transition somebody that you're dating with into suddenly being someone that's taking care of you. It's you know, I feel like that's next to impossible. So these are the things that are going to make caregiving easier. They've studied these things, and these are the main points that came out that will make caregiving, or that will help the caregiver in managing their stress and to be more successful in their caregiving. Hi, Luis. So number one is mastery. There's 4 things: mastery, coping strategies, social support, and stress reduction. So mastery, learn as much as possible about the disorder you are dealing with. The more you know about typical symptoms and behaviors, the better you can anticipate problems and not take them personally. All of which helps to build a sense of competence and control. Now, you guys can hear me, right? I feel like I'm screaming because the AC is on, but I'm just trying to talk a little bit loudly. So that's mastery. The more you know about the person's illness, the better handle you have on it, and the more confident you feel in your caregiving. The second one is coping strategies. The sound is perfect. Okay, perfect. Coping strategies. Turn to advocacy and support groups, counselors, and therapists to learn specific skills such as how to develop a more positive view of a loved one's behavior and how to think about one's own journey as a caregiver. Learn to focus on good care for your relative rather than making the person happy, which is often an impossible job. So those are 2 separate things. Being a good caregiver is different than making the person happy. Sometimes being a good caregiver means not making the person happy. And I've seen this in cases with dementia. My aunt has dementia, and her kids are constantly torn between doing what she wants and doing what she needs. And, you know, they have such an issue with her because she fights them on everything, and then they're just like, well, fine. You know, if she wants to just be dirty for a whole week, she needs to just be dirty for a whole week. And it's like, you cannot let her be filthy because she doesn't want to take a bath. So doing what the person needs as opposed to doing what the person wants is very difficult. And I think that's part of coping, is that you need to sort of separate out, you know, making the person happy and keeping the person healthy. And also joining support groups, which my parents have not joined any support groups. They don't want to know anything about my disease. They refuse to inform themselves. They refuse to hear any type of conversation in relation to my disease. I see a very similar dynamic now that my nephew has been diagnosed with leukemia. I have not seen that they have informed themselves about his disease or about, you know, what's going to happen with, is that cultural too? It can be cultural, yes. I believe that Hispanic people do not like to know about illness. They don't want to face it. My parents are in their 60s. I do believe it is cultural, partially cultural. My brother and his wife, I don't believe they're seeking any counseling for themselves or for their child. So, hi, Shadri. So, that is, I think it's partially cultural, but it's also just ignorance. And all of these things are being offered to them. Hi, Shadri. So, a lot of it is just ignorance. Yeah, a lot of ignorance. Hi, Browns. My Latino family very supportive with Lyme, but they are educated. Yes. If also your level of education as well. My parents are not college educated. My dad didn't graduate from high school. My brother didn't graduate from college. I'm good. How are you? So I think education also plays a big role. It's not necessarily that culture is 100% at fault. I think a lack of education is also part of the dynamic. So that's coping strategies. Social support. How do you manage anger associated with that? The unwillingness to become informed. You just have to put it to the side. I just have to put it to the side. I rarely think about it anymore. Set aside any notion that you should be able to handle the responsibilities on your own. Reach out to family, friends, religious organizations, volunteer organizations, and illness-specific support groups for sympathy, humor, and hands-on help. So that kind of goes with coping strategies. So it's social support kind of is a coping strategy. Go to support groups, connect with friends. I've been better this year about doing that for myself because I was basically a recluse. It makes us angry and hurt, but we have to save our energy. Yes. It angers you. It has power over you. Yes. I had to let it go. At a certain point, I had to let go of the fact that my family was not going to care. They're not going to care, and I can't make them care, unfortunately. So the last one is stress reduction. Do exercise. Do use respite programs. Respite programs are like when you send, your elderly parent to a day camp type of thing to give yourself a break. So use respite programs. Try mindfulness training, meditation, relaxation. Yeah, I didn't leave the replays. Mindfulness training, meditation. There's apps such as Calm and Headspace that can help you with meditation. But all of these things I can tell you do help. Yes, mindfulness is huge. I do something called paradoxical relaxation. I believe it's on my YouTube page. You can go and check that out. Hi, Mr. Romantic. I do something called paradoxical relaxation, and it has helped me a lot. Like I said, my family refuses to do anything and everything to help themselves. They refuse to do it, and I've tried. I used to try to push them to do it, but they are not going to do it. So you just kind of have to let it go after a while. So a few more statistics on caregiving, and then I'll open it up to questions because I know you guys have a lot of questions. You know what? A lot of it, I think, is they feel like they're enabling my disease by educating themselves about it. So, like I said, 43.5 million caregivers. At least 60% are female. Hispanic adults report the highest prevalence of caregiving responsibilities at 21%. 20.3% are African Americans, 19.7% are Asian, and 16.9% are whites. Nearly 50% of those caring for adults do so for a parent or a parent-in-law. 12% tend a spouse or a partner. 15% care for a non-family member. Female caregivers are more likely to provide personal care. 36% help with dressing, 31% with bathing versus 24% and 17% for men. So 36% versus 24% and 31% versus 17%. So the percentages of men doing personal caregiving is a lot lower. How much time do they devote? Family caregivers spend on average 24.4 hours per week. Nearly 1 in 4 spends 41 hours or more providing care. The average length of a caregiver's role is 4 years. 50% of caregivers provide care for a year or less. 24% provide care for 5 years or more. Yes, your husband, if it's just you and your husband is doing all of it, or most of it. So 24% provide care for 5 years or more. Here's the cost. Here are the numbers. Women give up an estimated $324,000 in earnings on average. Men lose $284,000. Cops are only shooting, I don't know what, that has nothing to do with this topic. Female caregivers are more likely to stop working. 12% of female caregivers are likely to stop working versus 3% for men. Or they take a less demanding job, 16% versus 6% for men. Trolling, yes. Single women caring for their family members are 2.5 times more likely than non-caregivers to live in poverty and old age. 72% of family caregivers report not going to the doctor as often as they should, and 55% say they skip doctor appointments for themselves. 63% report poor eating habits. I can tell you this firsthand with my brother and his wife. Now that their son is sick, healthy food is gone out the window. It's very difficult to eat healthy if you have a sick person at home. 58% say they exercise less than before taking on caregiving. 40 to 70% have clinically significant symptoms of depression. A quarter to half of this group meet the diagnostic criteria for major depression. Here are the rewards. There's just a few rewards. 81% of those caring for dementia patients reported gains as well as strains. The main benefits: spiritual growth, personal growth, feelings of mastery, and accomplishment. So that's a pretty big chunk. 81% of people feel better. Any sense of the differences between mental support versus physical support? Most of my needs are mental. This study was done for dementia patients. So this is very specific to people with dementia. But I do believe there was something, I think the article did address like mental, psychological disabilities as well. What do they need? 84% of caregivers say they need more help and better information. Yeah, dementia would be both mental and physical. And I'll get to that because I think there is a point about that. 1/3 say they have no help, paid or unpaid. The biggest worries caregivers have: keeping their loved ones safe at 42%, managing their own stress, 42%, making end-of-life decisions at 22%. The mental part of it is, they said here that people that are dealing with someone that has mental issues, dementia has a lot of mental issues as well. Like I said, my aunt has dementia. There's a lot of anger. There's a lot of insults being thrown around. And so one of the key things when you're dealing with a mental issue is not to take it personally. And there is a training program that they developed that they said that are they certified caregivers, non-certified, or both? I believe it says that they're unpaid, so I'm guessing they are uncertified caregivers. So 43.5 million unpaid caregivers. Rob Thomas's wife named Marisol just came out. That's why sick for so long. Yeah, I know his wife's name is Marisol. Is she sick? Did she get sick? So there was a program where they teach care. Oh, she has Lyme disease. Oh my God! How ironic. Her name is Marisol too, and she has Lyme disease. Caregivers are taught to sort of not take things personally and to learn to diffuse angry situations, not to react to that kind of thing. I was also, she has Babesia too. Oh my God. Ooh, that's a bad combination. I was married to someone who had a psychiatric condition, and I also had to learn how to, yes, it causes a lot of rage issues. I had to learn how to deal with my husband's rage, my husband's scatterbrained. I had to learn to communicate differently. And I think they teach that a lot as well to caregivers of dementia patients. You cannot react to their behavior the way that a normal human being would react. So I learned how to strategically work with his anger and the way that he thinks by reading a lot of books. I read every book under the sun about his condition. One of my challenges is finding support with acceptance of my limited social skills and outings. Yes, it is very hard. I also cannot go to support groups because of the lighting. So it's very difficult to find support when you are so limited. So, I had to read a lot. I had to read a lot of books. I read a book about communication, so learning how to communicate a little bit better. Obviously, when you're dealing with someone that has a psychiatric condition, there's only so much you can do. But, I did my best. My communication skills are a lot better. But when you're dealing with someone that has a mental health issue, it is very difficult to please them 100%. So you just have to learn to not take things personally. So that is the stuff that was in this article. There was some more stuff. It was a really good article. I recommend it. It's in the November, December Scientific American Mind. No, my husband did not have Lyme disease. He had a psychiatric condition. It was a diagnosed psychiatric condition. He was supposed to take medication for it. So I'm not, when I call him crazy, I'm just being, I'm being not politically correct, but he did have a legitimate psychiatric condition. I'm not making it up. A lot of people think that I'm just, that I kind of just make it up. But no, he did have a legitimate psychiatric condition. So, it was a very eye-opening article. Roast, I know. It was a very eye-opening article. It was very interesting. I highly recommend it for those of you that are caregivers or for those of you that are being cared for. But it's a really, it's very eye-opening, but I can also see, hi Young Callie, I can also see why my parents struggle so much because they are not taking advantage of all the services that are available to them. But I really think it's important. I See My Brother Unwell by Rob Thomas for later. Okay, I'll definitely write that down. Now that I see my brother and his wife, well, I haven't seen my brother and his wife. If you need painkiller, get on a high dose of methadone. I don't need painkillers, and methadone would probably make me very sick. I see my brother and his wife. Yes, we feel guilty about being burdens, yes. But I wish that my brother and his wife would take advantage of whatever is offered to them because they are going to burn out. They're already burning out, and it's only been a month. And, their child's diagnosis is going to be, it's going to be years. It's going to be a years and years process. But, I definitely, it's very frustrating, yes. I definitely see a lot of the anger and a lot of the resentment in my parents because they are not dealing with this situation. They're not dealing with what is happening properly. So, as you guys know, this past weekend was a very rough weekend. And I also struggle with accepting help and using all the resources available to me. And, like I said, that is partially cultural, partially a lack of education, and also in my case, yes, I do have difficulty accepting help, but it is also, a lot of it is pride, a lot of it is, I don't want to relinquish my independence. I tell myself that I can still take care of myself, I can still, do things, but unfortunately, I have to accept the fact that I, need help. So, I had written an email to some of my friends and, they wrote me back, but I did come to the realization that I may have to have a social worker come to the house to keep an eye on me. I have a ruptured disc, constant pain. I have to go to the clinic 2 times per week. Yes. Well, some people have relentless pain. It's very difficult. I also recommend physical therapy, manual physical therapy, not like running or stretching or anything like that. So, I am going to, get a social worker to come to the house, which was something that I didn't really want to do, but I have to take advantage of all the resources that are available to me. And, it is hard. It is very hard for a sick person to accept help. And I think it's even harder for caregivers to accept help because they're the caregivers. They're supposed to be the ones able to care for the other person. I think it's very important to recognize the fact that caregivers also need care as well. It's kind of like psychologists. A psychologist is providing care, but they also need care to deal with all the stuff that they're hearing. All right, Shuri, I'll see you later. So I'm definitely going to implement a lot of these things for myself. I would share this with my parents, but frankly, they probably wouldn't care. So mine is bone against bone, have to have painkiller so far, methadone lasts over 24 hours. Wow. That is tough. They cannot do surgery for that, can they? Because I'm sure they should be able. I know Paula Abdul has a lot of spine injury as well because of her history as a dancer, and I know that she also is on heavy painkillers constantly. They care. Yeah, I'm not saying that my parents don't care about me. They care, but they don't care. If I showed them this article, they wouldn't read it. They could care less. But their caring is very limited. Scared but might get surgery. Yeah, it sounds like you need surgery. Just a disclaimer, discuss meds with your medical professional. Yes, do not take medication without consulting somebody. I, unfortunately, cannot take most medications because I have some kind of genetic issues. All right, Bella, I'm almost done here anyways. Hi, Randy. So do you guys have any questions, any comments? A lot of people, I know a lot of you guys have asked about the whole sex thing. So I think once I get to 2,000 followers, I will probably do a scope about sex and chronic illness. Because I have gotten asked time and time again to talk about that. I've been a little bit apprehensive about addressing that topic because a lot of people don't take it seriously, but I actually think that it is a good topic. It's a topic that needs to be addressed. It's a topic that both men and women should listen to or need to be informed about. You might have already answered, but how has Lyme disease affected your relationship with your folks? My relationship with my parents was never good to begin with. Yes, the more formal scope would be a better forum. My relationship with my parents was never good to begin with. My mom is a narcissist, and I do not have a penis, no. My mom is a narcissist. My dad has a lot of issues because he was abused a lot as a kid. But since I've become ill, my illness I basically ruined whatever little bit of relationship we had because they did not believe me. They did not believe that I had an illness to begin with. So I finally got diagnosed, and they still did not want to accept it. At this point, they know that I am sick, but they don't want to deal with it. They don't have the emotional maturity to deal with it. So unfortunately, our relationship is still strained. It was okay when I moved back in a couple years ago after leaving my husband, but lately, yes, a lot of denial. They can't see how I feel. The one thing my mom does worry about, though, is my weight. She is very, very worried about my weight. I'm sorry. Yes. Well, most people with Lyme disease, they deal with the exact same thing. Their parents don't believe them. Their friends don't believe them. Hi, Ricky Ricardo. So, I'm not the only one that's dealing with this. It's just unfortunate that I'm stuck living with them. That's the hard part. But yes, so how could you be a woman but used to be a man with no surgery? How old are your parents? They are in their 60s. Hi, Ricky. So yeah, a lot of people want to know about the whole sex thing. I have a long history with pelvic pain, so I do know a lot about how chronic illness, Lyme disease, neurological problems, how they affect sex and your female organs. Is there a cultural difference as well with your parents? Yes. They don't believe in going to the doctors. They don't believe in any of that kind of stuff. And they hated the fact that I was paying for medical care. But I had no choice. Religious? No, not really. It's not really a religious thing. It's mostly cultural ignorance, lack of education. But yeah, the scope, I might make the scope half personal, half sexist as well, yes. I might make it half personal, half clinical, I guess, because a lot of it is personal stuff that I've gone through, dealing with pelvic pain and being very young. You know, you need a doctor. Yes, I don't have a doctor for chronic illness anymore. What are the FAQ? Frequently asked questions. Well, one of them is, can you have sex? That is definitely one of them. The other one is, you know, are you underweight because of your illness, or you just don't like to eat? I get a lot of anorexia stuff from my relatives because everybody in my family is obese, and I'm obviously not obese. So a lot of people think it's anorexia, and my parents won't tell people that I have an illness. So if you're not telling people that I'm sick, they think that it's anorexia or a mental issue. I get asked what my symptoms are, which my symptoms are mostly neurological. I don't have the typical Lyme symptoms of fatigue and joint pain. I do have fatigue and I do get joint pain, but it's very rare. I don't have that. I don't have that very much. That's why I've always doubted that I had Lyme. You know, I never thought that I had Lyme disease to begin with. I still sometimes don't think I have Lyme disease. I get asked who left. Who left? Did your husband leave you, or did you leave your husband? And I think the reason a lot of people ask that is because number one, they're immature and they're stupid. So I think it's a very stupid question to ask. But I think they want to know who's the problem. Who was the bigger problem? Just shut up and quit complaining. Stay in your lane. Be a good wife. Shaking my head. Yes. Yes. So, you know, people ask who left. And technically, if I have to choose who left, I left. But we had both already decided. We were in counseling for, we started counseling, I think, in January, and then I left in August. I was supposed to leave I was going to give it until September, but we had an incident, and I ended up leaving a couple weeks before we had planned. It's couples that don't work, not one or the other. Exactly. It's both. It's both. I've heard about ticks. Now you're scaring me from camping and hiking. I've taken ticks off of me. Yes, be very, very careful if you go camping or hiking. I used to go camping a lot as a kid, never had any issues. It wasn't until college. I think I was on a film shoot, and I think that's when this happened. But as a kid, I used to go camping, never had a problem. So, you know, those are the most common questions. You know, with the whole marriage situation, you know, there's, because both of us had problems, I think it complicated it a lot. I think that if he would have been, you know, I don't want to say completely normal, but if he had not had psychiatric problems, things would have turned out differently. Or if I had not been sick, I could have dealt with a psychiatric condition. We could have invested more money into his issue. Have someone look you over after being outdoors. Yes. Not everybody gets the rash, though. Not everybody gets the bullseye rash. I never got a bullseye rash. I have no idea when I was bitten. But definitely look out for the bullseye rash, but no rash for me. So yeah. Any other questions, comments? I'm trying to think if there was anything that I missed in the article. I will put this one up on YouTube. It should save automatically to my phone. Sometimes they don't. Never had a problem, but I have taken ticks off my body. It hurts. Well, you know what? They say that you can't feel it when they bite. I definitely didn't feel anything. But they say that you can't feel the bite. They can be teeny tiny, as big as a poppy seed. So you can't see them either. Yeah, you don't feel them. So if you felt it, it was something else. Something else must have bitten you. So be careful, because if you're feeling it, it might be something else. So yeah, those are the common questions. I definitely think, a sex scope would be really good. All of us in the scope respect and support you. You're a tough person. Thank you. They don't all carry Lyme, no. So it's not a guarantee that you'll get Lyme disease if you get bitten. So once I get to 2,000 followers, if I can get to 2,000, then I'll definitely prepare. I also have books, recommended reading, and stuff like that. So, I know a lot of people have curiosity, and I have gotten the request a lot. So I definitely think it's time to approach that topic. But, some people are going to take it seriously. Some people are not going to take it seriously. So, we'll see how that goes. But I will prepare for it. And hopefully you guys will find it very informative. Especially the guys. I really think guys need to know a lot of... usually guys do not warm up to female issues very much. And it's very sad, because keep going strong, you're a good person. Too bad your parents. Yes. Thank you, Bobby. I think a lot of guys are very squeamish when it comes to actually talking about female stuff. No comments part and then a comments enable part. Yes. Yeah, I definitely. Well, you can only disable comments for people that are not following you. So, or people that you are not following. So I would have to unfollow everybody. But I'll definitely just, I won't pay attention to the comments. But yeah, and if you guys also, before I go, if you guys have any topic suggestions, you can tweet me on Twitter, hotsun100384. I trust most of them. So tweet me, hotsun100384, if you're interested in a topic, or if you want me to talk about a topic, or if you want me to review a book, because I've gotten also requests for book reviews. I haven't gotten around to that though, because I've been busy with stuff. So yeah, just let me know. Follow me on Twitter. Everything is in my profile. My You Caring page is in my profile. I will let you know if I start fundraising. Talk about future goals. Somebody asked me that the other day. Sometimes I say kind of raunchy stuff. Yes, it's okay. It's all in fun. I understand sometimes we joke around, and I want to keep it lighthearted a lot of the time. I don't like talking about my illness, very often. So I like to keep it lighthearted. That's why I reserve one day a week to do these kinds of topics, because I don't want to be constantly, talking about this. But yeah, tweet me with topic suggestions. I'll write them down. And check out my You Caring page. I'll let you know when I'm fundraising. Check out my YouTube page. It has all of my previous scopes. And I think I have an Instagram. I made an Instagram for my dog, but it's kind of pointless. Talk about why women find Billy Bob Thornton attractive. Yes, that's a whole completely different topic. But yeah, he's something else. So guys, that's what I have for today. How do you manage to stay so damn sweet? I'm not that sweet. I'm not that sweet. So I can't say that I'm an easy person to deal with. I will never say that I am, but I try my best. So that's the topic for today. I'll leave the replay up for you guys, and I will try to upload this one to YouTube. Hopefully it's saved to my phone. Maybe I'll be on again later. It is about 1,000,000 degrees outside, so I probably won't go to Starbucks. But that's understandable considering you're dealing with a lot. Yes, thank you. So I'm kind of sweet. So I'm like those, what's that candy? The Sour Patch Kids. First they're sour and then they're sweet. So that's kind of what I compare myself to. You remind me of girls in the 60s. All right, guys. So follow me on Twitter, hotsun100384, and I will be back with another topic next Thursday. Take care, you guys.